So for the Biology 2.14 lab, describe the following process of ventilation with regard to the muscles or other tissue involved in the movement of the gases in response to the intrapulmonary pressure and atmospheric pressure. For inspiration, the muscles happen in the thoracic cavity, and they are responsible for inspiration in the diagram for the external intercostals, plus some accessory muscles, which include the sternocleidomastoid and pectoralis minor muscles. So in the diaphragm, the muscles will contract, causing the diaphragm to flatten and increase the volume in the thoracic cavity. And the external intercostals contract will be pulling the rib upwards and outwards, which will be expanding the chest. The additional muscle groups will help pull the ribs up and out, which is the accessory muscles. For the pressure points in the diaphragm, it moves inferiorly during contraction, and the ribs are elevated and the sternum flares as external intercostal muscles contract. For expiration, the muscles that are responsible for expiration are the abdominal muscles and internal intercostals, plus some accessory muscles as well, such as the quadratus lumborum. The diaphragm muscles relax and cause the diaphragm to curve upwards and reduce the volume of the thoracic cavity. The internal intercostal muscles contract, pulling ribs inwards and downwards, which was reducing the breadth of the chest. And then the abdominal muscles contract and push the diaphragm upwards during a forced exhalation. Additional muscles, which is included the quadratus lumborum, will help pull the ribs downwards. And the movements is that the relaxation of the diaphragm and the elastic recoil of the tissue decreases the thoracic volume and increases the intravalvular pressure, which is when the expiration pushes the air out of the lungs.